So I'd like to just introduce Maryann. I first met Maryann not long before our Feminine Wisdom course, and it was much like this in Zoe's living room. So for those of you who've done the online course, you'll know Zoe. And she does groups where she gets women together and she has different interesting speakers. And Maryann spoke about tissue salts, and I've always used tissue salts, especially when our children were little, and I loved them. I found them effective. They're a great option. They were effective, but I think now realizing about purity and things, a lot of the tissue salts we buy in Dis-Chem are a bit like the essential oils we buy in Dis-Chem. There might be fillers, they're not as therapeutically high, not often not even as close as to what one can do with pure tissue salts. And so Maryann, I was blown away by her talk, and it was so interesting. And so I invited her. Well, I first asked for her period mix, which you all got as gifts in your Feminine Wisdom gift pack, and so many people have said it really helps enormously. And so I wanted to have this opportunity to expose more of us to tissue salts. And Maryann can tell you a little bit about what she does, but she does do personal consultations. She'll tell you a bit about her story and everything, and how she came to doing this and empowering herself and her health. And yeah, as apologies, we were going to have the tissue salts thing on the TV, but it's not working like that. So better done than perfect. So welcome, Maryann. It's lovely to have you.
Thank you. Thank you for inviting me.
But you might have to speak quite loud for everyone.
Okay. All right. So sorry if I'm shouting for everyone in the room, but hopefully everyone can hear me at the end of the day. Okay, so just to start off with a little bit of introduction on how I came to tissue salts is I've always been a very healthy person. And when I was 40, I was diagnosed with bilateral breast cancer. Out of the blue, don't know where it came from, whatever. And in true medical fashion, people like push you into things very quickly. And it's like, no, you've got to have surgery. No, you've got to have chemo. No, you've got to have radiation. So I just went this, okay. And you get so overwhelmed with going through what you have to go through that you often don't stop and ask questions. So I just went through the whole process, the whole protocol for 5 years. So I went through 6 months of chemo. I had surgery first, 6 months of chemo, 6 weeks of daily radiation, and then you go on the 5-year protocol of hormone blockers and scans and blood tests and everything. And I did everything to a T for 5 years. After 5 years, my oncologist said, super duper, you're all clear. Go forth and enjoy your life, which I did. And at the end of the 6th year, the cancer came back. Mm-hmm. So that's when I actually started questioning to say, well, hang on a minute. I've done all the right things. I've done everything that you said I should do. So why is it coming back again? And I just realized that it's so easy to get caught up, especially when you are feeling overwhelmed. And you trust what the doctors are telling you, because they're the experts, they're the specialists. So where I had, when the cancer came back in my uterus, so I had a hysterectomy, and then I said, whoa, stop, no more. I'm not doing anything else. So I didn't have any treatment. I didn't go for any checkups. So that was, so I was 46, okay, so 10 years ago. For the last 10 years, I have not seen an oncologist. I haven't had one checkup. I haven't had one blood test, and I'm here to tell the story. But the big thing for me was just taking your power back and being able to make your own decisions, especially when it comes to your health and your family's health. And I started exploring all kinds of things in terms of alternative health options. And I've explored a lot of them. I studied kinesiology, which I absolutely love. I've then gone from being the home tissue salt person to actually studying it and qualifying in biochemic therapies, which is a very fancy way of saying tissue salts. Okay, tissue salts therapy. So so I for many years have always used tissue salt on, like Nikki, on her family. My kids grew up and couldn't come and ask for an aspirin or something, because they were told to, here, take this tablet and tap your head over here and do whatever. So that I was always the weird mom, but
Like many of us.
So yeah, so to me, you know, having this wonderful opportunity to talk to people about the tissue salts is really about educating people so that they can help themselves. And that really has become my philosophy, is helping others to help themselves. I don't believe that you should be dependent on a specialist for, you know, for everything. If you have the knowledge, then you are empowered, and you can obviously make choices. I'm very happy to answer questions and guide you and help you along the way, but it's also about education and allowing you to learn about these tissue salts. Because when you go into a shop to buy a bottle of tissue salts, they might have a little description on it, and you kind of go, oh yeah, that sounds about right, and off you go. But I'm hoping that we can go a little bit beyond that today and just have a look at a little bit more detail what's actually behind them all. So I have, no, that's not going to work. Okay, so biochemistry has been around for years and years. It was originally studied in the 1800s by Willem Schussler, and that's why you'll often hear the tissue salts referred to as Schussler salts as well. So all the same thing, okay, and in part of his studying, he established that we have minerals in our bodies. I mean, they are there. We should get them from our food, and they play a vital role in the cellular health of our bodies. Okay, so we're looking at a cellular level of everything here. He also said that when our bodies lack the necessary nutrients, cellular activity declines, and our bodies become prone to illness. So if our cells are out of balance, we're basically allowing unwanted things to come into our bodies, because the cells are being receptive to unwanted things because they are out of balance. Okay. So cellular nutrition can be revitalized by supplying deficient minerals, but the thing is that they must be readily in a form that the body can readily absorb. All right, and we'll talk a little bit more about supplements a bit later. So tissue salts are vital for our bodies. We do need them. Okay, so if it's so vital for our bodies, let's look at why people have deficiencies. Because most people, in fact, I don't think I've come across anyone who hasn't had a deficiency. Everyone has got deficiencies. So what is causing that? Well, the main thing that's causing it is that our soils are depleted of minerals. So we're not getting the food that we eat is not getting the right minerals as it's growing. And secondly, yeah, it is what we eat as well. So if we're eating a lot of junk food or highly processed food, we're not going to get those minerals that our bodies need. Air pollution affects what our bodies are able to absorb with all the toxins in the air, as well as the electromagnetic pollution that we all live with all these wonderful Wi-Fi's and everything in our houses that obviously we need, but it does start affecting our bodies as well. Our stress levels as well affects the minerals that we are able to absorb, or our absorption of the minerals. And then the lack of exercise and oxygen or water. If we're not drinking enough water, that's also going to affect our body's ability to absorb the minerals from the food that we're eating. Okay. So let's look at what tissue salts actually are. They are food. Okay, so we should get them from our food, and if we're not getting them from our food and we have to replace it with tissue salts are just part of that food. So you can't ever overdose on tissue salts, which is I think should give everyone a sense of comfort, because if we're going to be educating ourselves and saying, okay, I want to go this route, I want to use the tissue salts, I want to maintain a healthy body, and then you have that fear factor coming in of, oh, what happens if I take too many? Okay, you can't. You can never take too many. Your body will absorb what it needs, and whatever it doesn't need, it will get rid of to the best way it can. All right. So tissue salts themselves are they're minerals which are normally found in soils, in rocks, and what they do is they extract that, and then using the homeopathic theory of trituration, they dilute it, because we need tissue salts in a very micro format. So when we're taking a supplement, for example, if you're taking a calcium tablet, it's in a macro format. So when you take any tablet, it's going to go through your digestive system first, and then it's going to start being absorbed by your body. Whereas if you take a tissue salt, you dissolve it in your mouth, and it crosses through the mucous membrane of your mouth and goes directly into your bloodstream. So it's straight away accessible and transported to various parts of your body where the cells would be needing it. So the macro format that a supplement would have is harder for your body to absorb. It's still got to break it down into a micro format. Whereas when you're taking tissue salt, whether it's in tablet form or powder form, it's already in that micro format, which makes it very easy for your body to absorb. The other thing with tissue salts is that they are non-toxic, and you cannot, I know you can't read this, but it's just for me to follow it more than anything else. They're non-toxic and non-addictive, so you cannot get addicted to them. I'm also of the belief that you shouldn't have to take tissue salts for the rest of your life. You should be able to get your body into balance and hopefully then maintain that balance. And if it goes out again, then you start taking a specific tissue salt. So it's not one of these things. And my pet hate is when a doctor says to somebody, you need to take these tablets for the rest of your life. Okay, so
this is the same as oils. You know, they should replenish your body,
yes,
and then help you to get to a better place of healing and restoration. Then you might not need it, but then often we through how we live, we often need it to top up again.
Yes, absolutely. And I find obviously if people are taking medication that is depleting their body of minerals, you're going to have to keep on going with it. Okay, so I have, for example, clients that are on ARVs, and ARVs will drain the calcium from your body. So you need to then, as long as you're on ARVs, you need to be replacing your calcium somehow. So, but for a healthy person that's not on permanent other medication, it should be fine. So who can take tissue salts? Anyone and everyone. Okay, so babies, pregnant ladies, children, adults, animals, anyone can take them. They're completely safe and harmless to anyone. Obviously, the dosage will differ depending on how big the body is in terms of if it's a baby or an adult, but completely safe. So in terms of medications and supplements, people often ask, is it safe to take whilst I'm taking other supplements or whilst I'm taking medication? Absolutely. So what will happen is if your cells are in balance, then your body can more readily absorb supplements or medication. So it's actually going to enhance the effects of your medication or supplements that you need to take. However, I do always question why you're taking something, because I'm actually amazed at how many people take so much medication and supplements, especially when there's these different sort of, I don't know, there seem to be like trends that go around with supplements. And then someone will say, oh no, my friend told me about this, so I started taking it. And then years later, they're still taking it and they don't even know why they're taking it. So I do question my clients as to, and sometimes, I mean, often there is a very valid reason to take it, but I would like people to question themselves why they're taking things. I had a client who, I did a full consult with her, and she had given me a list of her medication. And when I went through it after the consult, I saw she was taking medication for a stomach ulcer. So I actually phoned her. I said, that's strange, because you didn't mention you had a stomach ulcer. It's quite important that I know that. She said, I haven't got a stomach ulcer. So I said, well, why are you taking that medication? And she said, I don't know, the doctor gave it to me. And she'd been on it for 2 years.
Wow.
And she had gone to the doctor 2 years ago with a stomach complaint, and the doctor didn't know what it was. So here, take this medication. And 2 years later, she was still taking it. So I was absolutely astounded with stories like that. Okay, so basically what we can say is that the tissue salts will get your cells back into balance so that they can more readily absorb the medicines and supplements. And again, medication and supplements are at that macro level. So they're going to go through your digestive system normally and be absorbed and then broken down until it can get the mineral into a micro level so that your body can absorb it. Okay, whereas tissue salts is going to be able to absorb it straight away. Now, we all have Mrs. Google as our best friends, and people will go and research on Google, which I do encourage, about tissue salts. But just something
DuckDuckGo or
Duck-
not Google.
better maybe DuckDuckGo. Okay, so just something to be aware of is that the numbering of the tissue salts is different in different countries. So when you are researching, make sure that the name of the tissue salt is correct. Okay, so the original numbering, it's always 1 to 12, but they just switched them around because at one stage they dropped one of the calcium and they said, no, that wasn't one of the minerals, essential minerals that we needed. And so they went, what we know is, iron is number 4. So iron shifted up to be number 3 because that's where that calcium was. And then they decided, no, actually it is an essential calcium. So they added it back, but now they added it at the end of the list. So that calcium went to number 12. All right, so just be aware of that and look at the names as well, just to double check that you are talking about the same thing, because otherwise you'll get very different answers if you're just going on the numbers. Okay, but in South Africa, and that's obviously what I work with, is just what I know is the 1 to 12, but just be aware that if you are researching, you might come across different numbers. Okay, and although there are 12 tissue salts that are very common, and that's the ones that most people know about, you can actually get up to 25. Okay, but well, no, sorry, correction. You can't get up to 25. I can get up to 25, but 1 to 12 is readily available in shops. All right, so you can just purchase those as you wish. So let's go through them and see. We'll just go through them with each number and see what they're all about. So number 1 is calcium fluoride. So everyone associates this with the teeth, which is correct to an extent, but there's so much more that calcium fluoride does. So calcium fluoride is to do with elasticity. So if you think of everything in your body where there is elasticity, the first thing that comes to mind is your skin and your wrinkles on your skin. Okay, why do you get wrinkles? Because your skin loses its elasticity. So it's not going back to anything that is expanding and contracting in your body. For example, your arteries. Every time your heart beats, they're expanding and contracting. So what happens is if you are lacking in calcium fluoride, that ability to expand and contract diminishes. And that's when you start getting problems with collapsed arteries and things like that. So that would be a major sign of a deficiency in calcium fluoride if you started having arteries collapsing on you. It also supports along those lines is varicose veins. Again, those are little veins collapsing. And you'll often see that with people on their legs or around their noses, on their face. You'll see those little varicose veins coming along. It's that can be corrected with calcium fluoride. But calcium fluoride is one of the very slow acting tissue salts. So it is one that you would need to take for at least 3 to 6 months before you're going to see a result. Okay, so it takes a long time to correct any imbalance that is in the body. And in terms of the teeth, the calcium fluoride actually works on the enamel of the teeth. So it's looking at the outside structure of your teeth and your bones. It's the outside structure that calcium fluoride works on. Okay, Also, in looking at elasticity, if you think of all the ligaments in your body, people that are getting prolapsed organs, the prolapsed bladder is a common one. It's your ligaments are stretching and not being able to contract again. Okay, so all points to a calcium fluoride deficiency. Okay, moving on to number 2, which is calcium phosphate. So calcium phosphate also works with teeth and bones, but now we're working on the inside. So it's the inside of the bones, inside of the teeth. It also regulates cell growth, so it is a cell builder. And it also helps with digestion. It's a sort of a nutritional tonic and assists with digestion. So again, very good for children growing. Even the elderly people, they will also need this for their bones. So basically what this, and in terms of the digestion, it's going to activate the pancreas to produce digestive enzymes, which we need obviously in order to digest. Okay.
So it helps the pancreas.
Yeah, it supports the pancreas. So the pancreas, if the cells within the pancreas are in balance, they're going to be able to do what they are designed to do, which is to produce those digestive enzymes. Okay, so the whole thing with tissue cells is getting everything back into balance. If your cells are in balance, they can perform what they're meant to be doing. Okay. All right, so number 3 is calcium sulfate. So this is the one that sometimes ends up being number 12, but in South Africa it's number 3. Okay, so this is a blood purifier and a cell healer. So this is very good for slow healing wounds. This will help with that. It seals and holds. So if you have that open wound that's been just not closing up and healing, this is the tissue salt that you need. It also eliminates pus. So if you think of boils, pimples, ulcers, anything like that, it's going to help to eliminate that pus. And not only pus, but any sort of waste products in the body, this tissue salt will help to remove it. So it is a blood purifier. People have got blood issues going on in terms of toxins or that in the blood. This is the tissue salt that they would need. Okay, ferrum phosphate, otherwise known as iron, is number 4. This is very good for the first stage of infection. So as soon as you feel yourself coming down, you know, when you get that feeling that you just feel that you've got a bug in you and you're coming down with something, but you don't know what it is, start taking ferrum phos. Okay, so, and we'll talk about dosages later. But this is really, really good. So often people, I think iron as a supplement is one of a common one that people take, but they say it doesn't help me. Okay, so remember the first thing is they're taking it in a macro format. So it's going through the digestive system and their body's not absorbing it. So all they're doing is going in one end and out the other end.
Well, it's quite constipating sometimes.
Absolutely.
So it actually sometimes doesn't come out that way. So actually, yeah, that's fine.
So when you're taking supplements, sometimes you do have to deal with those side effects, like the constipation with the iron. Whereas if you're taking a mineral salt, you will never have side effects. There are no side effects to mineral salt.
I suppose also if your digestive system is not functioning optimally, then your body is not absorbing as much through that route.
Yes. So with it going through your mucous membrane and going directly into your bloodstream, it can get you where it needs to be.
Without going through the digestive system.
Yeah, absolutely. Yeah.
Interestingly, with homeopathy, there's a saying: if you're at a loss, take ferrum phos. So it's for the beginning of those infections. And
absolutely.
Yeah.
Absolutely.
Yeah, and aconite.
So yeah, this is really, it's the first aid tissue salt. Any signs of infection, fever, this is what you take. I have one of my sort of pre-mixed remedies is something called a cold remedy. So again, at the first sign of any kind of sniffle, sore throat, cough, you start taking this remedy. So it's got mainly the iron in it, but a few other things as well that will stop that from developing. And all you need to do is take maybe 3 or 4 doses, and 3 or 4 doses can be taken in an hour, and it will go away. Okay, so you can literally stop things in its track. The earlier you catch it, the more effective it's going to be. So if you've now, you felt yourself coming down and you thought, oh no, it'll go away, and another day goes by, and another day goes by, and now you are really sick, you actually you're fighting an uphill battle. Whereas if you had just taken the tissue salts at the beginning, it would have been able to sort that out immediately in your body. Okay. So people that yesterday heard from a client of mine who has had prostate cancer, and he went for blood tests beginning of the year. His iron count was hectically low, so we put him onto tissue salts, and over the next few months it just like came up, so it was wonderful. So we could see straight away that it was having an immediate effect for him. Yesterday he phoned me to say he went for bloods yesterday and the iron count's going down again. It's dropped down, not to where it was, but it's dropped down. So what's happening there is his body's obviously not absorbing it anymore. So although he's doing it through mineral salts, it's still not having enough of an effect. So what we need to do there is look at, well, what else can enhance the absorption of iron? And in this case, it's vitamin C. So he needs to take some vitamin C with his tissue salts, just to help with that iron absorption. Okay.
I think what's interesting is you can follow the whole imbalance. Clearly not getting enough vitamin C and obviously other things.
Yeah, absolutely.
That's very interesting.
The other thing with iron is iron transports, attaches oxygen molecules to it and transports oxygen around our body. So if you think of anything where you feel shortness of breath, you need iron. You're feeling dizzy, you need iron. Okay, it's because we need to get that oxygen around the body. So all of those things related to oxygen in your body, it's so often linked to iron.
It's been so useful in COVID times as well.
Absolutely.
Because of that. And I presume it's also in your period mix.
Yes.
Yeah, because of our loss of iron.
Absolutely. Yeah. So when I do the mixes, all I'm doing is I do mixes for common kind of ailments, for want of a better word, where I know that there's a set combination of tissue salts which would work best. So like that period mix, it's kind of, we know what we go through every month, so we know what we need. So it's the pre-mixed tissue salts are great for treating an acute condition, or like a period that we know is coming every month. You don't need to take it all the time, you only need to take it during your period. And you can start maybe the day before. But when you're treating a more long-term deficiency, that's when you need to see a therapist and help that can help you through that.
May I ask something? Would it help if you're menopausal?
Yes.
How would it help?
So again, we don't want to put labels on things. So what are your symptoms? Because your symptoms when you're menopausal are going to be different to the next person's symptoms. So we need to understand, how is your body responding to it? And then we will try and treat that. So if, for example, hot flushes, that's a common one that most people have when they're menopausal. So we want to work on balancing that. So again, it's just balancing. So yeah, so depending, so that's why I
use that particular one for hot flushes.
Which one?
The menstrual one.
It's got stuff in there that would definitely help. Yeah, but there's a better combination. Okay, but as again, that's something, because that's not even if you think of the period mix, not everyone has the same symptoms whilst they're having a period. So ideally, you could get something mixed up specifically for you and what you experience every month. Okay. All right, so let's go on to number 5. Number 5 is called Kalimur, is the common name for it. Also called potassium chloride. This is effective for the second stage of infection or inflammation. So it will also help with colds and coughs that have now just gone beyond that initial stage. So what is important to look at, and people think it's a bit gross, but I always ask, well, what color is your mucus? Okay, because it's important to know, because that's going to tell you what stage of the infection you're on. Okay, so if you have a cold, you're going to start off with a runny mucus, which is going to be number 9. Then you're going to come on to here, and your mucus is going to go white, and you're going to come to this one. Then it's going to go yellow, and then it's going to go green as it gets worse. Okay, so this, depending on what stage you're trying to catch it, will depend on what tissue salt you need. All right, this is also, number 5 is a glandular tonic and a congestion remover. So it'll help with swollen glands, especially swollen lymph glands. Any glands, this will help support it. So it doesn't necessarily have to be a swollen gland. If you have any issue that your symptom is related to a gland not functioning the way it should, then this will be the salt that we would use to bring it all back into balance. Okay, number 6.
Sorry, just on number 5, you said
Yes.
aids digestion of fatty or rich food. So
Yes.
is that like obviously then for like the gallbladder?
Yes.
If it's not
Yes.
functioning.
Yeah.
Or even a fatty liver.
Yeah, there's a better one for that. Okay. So number 6 is Califos, and this is a brain and nerve tonic. So remember, tissue salts brings everything back into balance. So if you have somebody who's very anxious, especially with children, just if they have that anxiety at school or whatever it is, this is the one that they should take. Last year, my husband was diagnosed with Guillain-Barré. So Guillain-Barré attacks your nerves, or your immune system attacks your own nerves and eats away at your nerves. So he became completely paralyzed. So he had to go into hospital and go through the whole rehab thing and everything. He's up and about and playing golf and all those good things now, so all is well. But I started him on number 6 when he was still in hospital. So much to everyone's like, oh, what's that? Why have you got that next to your bed? Yeah, he was taking it from then, because that was just going to help those nerves to restore the balance. Okay, he still takes it. So that's because he has nerve pains and things, so he obviously still needs it.
So would you do that in conjunction with C and B curve?
Yeah, yeah, absolutely.
Would this also be good for neuropathy and with cancer and
Yes, absolutely.
and fibromyalgia? And all
Yes,
those things?
yes. So that's why it's important to, when people have labels, and we do have labels for a reason so that we understand it, but we need to know specifically what are they experiencing with it, so that we know which tissue salt to will be best for them. Okay. But anything to do with nerves and restoring nerves, like, so that's on a more physical level, but also on that emotional level, that anxiety, etc. Also, for the brain, it's also a brain tonic, so it will help with poor memory, with concentration. So lovely for kids if they're stressing with exams. So you've got that the stress of the exam, but they also then are battling to concentrate, to learn, to study. So this is a lovely one for them to have whilst they're writing exams.
Would that be a normal thing that you would give with ADHD, for instance?
Absolutely, absolutely. With other things, but
Yes.
this will be the main one.
Yes.
Yeah.
Very interesting.
So a much better option than with them and so forth. Okay. Right. Number 7 is Cali Salt. This one, if you think of 7, is very much related to hair, skin, and nails. Okay. So sorry. And it's also a mucous membrane conditioner. So it will also help with 3rd stage of infection. And this is where you'll be looking for yellow mucus to use number 7. With COVID, people that have had COVID and mucous membranes are damaged, this will be part of that recovery. Yeah, to try and get them back into balance. So yeah, but skin as well. Any like age spots on the skin, pigmentation on the skin, dry brittle hair, we would put a combination of this and number 9, but hair issues, hair falling out, we'll put this with number 2 probably, but yeah, so if you think 7, it's hair, skin and nails.
And if it's mucous membranes, and it's also then it would be like the lubrication and things like that, your vaginal lubrication would also be affected.
Yes.
Or be helped.
Yes, absolutely.
With Cali Salt.
Yes, because it's all mucous membranes in your whole body. All right. Number 8, most people know about this one. It's a magnesium phosphate. Okay, so this is a nerve and muscle relaxant. So a lot of people, the reason why people know about it, it's anything spasmodic. Okay, so if you have a muscle cramp, magnesium phosphate. If you feel nauseous and you're vomiting, magnesium phosphate. Yeah, anything where you are cramping or you have spasms. If somebody has like a tick in their eye the whole time or in their mouth, magnesium. Okay. It also is a bit of a painkiller as well because it's relaxing everything. Okay, so if you think of it as being the relaxant, it will help often with pain, especially if it's a tension kind of pain. So this one is really good for headaches because a lot of our headaches are caused by tension. So a lovely way to take the number 8 is something, okay, it's called a hot 8, but it's actually just number 8. So all you do is you put 3 teaspoons of hot 8 in a glass of water, hot water, warm water, not boiling, warm water. So do like half boiling water, half normal water, normal temperature, and you sip on that. So if you're sipping tissue salts where you've diluted in water, because it is another way of taking tissue salts is to have it in water. You need to still let it go through your mucous membrane in your mouth. So when you take a sip of water, you need to hold it in your mouth. Okay, so for about 15-20 seconds before you swallow it. If you swallow it, there's no harm done, but then it's now traveling all the way down there, which you wanted to get into your bloodstream as soon as possible.
Does it, even if you take it in water, does it cross the blood-brain barrier? Is that what's actually happening?
Yeah.
It goes through your mucus.
Yeah, so remember, it's the micro minerals that are being absorbed. So you're still going to swallow the water, obviously, but you want to give those minerals a chance to cross over.
Absolutely.
Okay. So one of the common signs of magnesium deficiency that you see quite often is people with very rosy cheeks. So not when they're sitting by the fire, but and you see it with kids often, but they have these very rosy cheeks, and people kind of almost, when they draw a little amateur picture of a kid and they have these little rosy cheeks, it's actually a magnesium deficiency. Okay, so yeah, so that's a good one to watch out for. All right, so let's go on to number 9.
It's actually so interesting because my little one has just had a tummy bag and vomiting.
Yeah.
And he's had such flushed cheeks as probably from, I don't know.
Yeah.
And I wonder whether also like from children with growing pains, you'd think the growing pains is also related to magnesium.
Yeah.
And so, and that's up in a similar time when you've got the rosy cheeks and things.
Yes. Yeah. So, and then growing pains would also link back to the number 2 with the calcium phosphate. Yeah. Okay. Right. Number 9 is Netmu, otherwise known as sodium chloride, which is table salt, but it's not table salt. Okay. Table salt is not what we need. All right. So Netmu is a lovely tissue salt. It's to balance fluids in the cells. So if you think of anything where you're at a cellular level, you go out of balance with the fluids, it would be dry skin, dry hair, that runny nose as well. It's your cells are now releasing all this fluid, so you want to get it back into balance. Again, post-COVID recovery, you want to get your cells back into balance, especially with your sense of smell. You need to get the fluids back into your cells. Okay, so this is the one that you would take at the beginning of an infection where you have the clear mucus that hay fever, it would help with, again, because that's balancing the fluids in the cells. So hay fever, sinus, all of those things. So this is a really nice one. And in winter, often because we're in environments where we have heaters on or fireplaces or whatever, it does take a lot of moisture out of our body. So this will be a good way of getting it back to balance it. Right. Number 10 is NatPhos. Now this one is a acid neutralizer. So a lot of us, thanks to all the sugars and everything that we eat, have a very acidic type of body, which is not the way it should be. So if you take alkaline powders to try and reduce that acidity, you're actually going the other extreme. So you're then creating an alkaline environment. So with the tissue salts, what we're doing is we're trying to balance it, because we do need some acidity. We still need to digest our food. If we don't have acidity in our body to digest our food, we won't be able to do it. So if you take antacid tablets, it's going to the extreme. Okay, so you use this with the tissue salt with number 10, it will balance it. So very good for heartburn, acid reflux, conditions such as arthritis, gout, where there's a buildup of uric acid in the body and causing all kinds of aches and pains. So that's number 10. Okay. Number 11 is the fluid eliminator and the liver cleanser. So we were talking about the liver earlier. This is the one that you would use to support your liver. All right. So if it's going to eliminate fluids, so these are the fluids that are in excess in the cell, or it's not only eliminate fluids, but it eliminates toxins as well. So this is what you need to flush everything out of your system. So swollen ankles, any kind of liver condition, and this is what you would need. And what's that?
A hangover.
Hangover.
Yes, I have a mix called Party Mix, and this is in there.
So all the lymph conditions. Like
Yes,
people.
absolutely. Yeah. And the lymph environment is also often an acidic environment. So it would be that combination of 10 and 11 for lymph. Okay.
So it must help with, if it's water retention for flying, if you're flying and you get
Yes.
swollen
Yeah,
ankles.
absolutely. Yeah. Okay. And then in terms of going back to our lovely topic of mucus, this would be when the mucus is green. So this is now final stage of infection that you would need number 11, because now you want to get all those toxins out.
We're all smiling because we've just had this big green snot class.
That was with the oils, yeah.
The green snot glass.
Stopping the snot going green.
Okay. So with the oils, I hope you don't get to the stage of green
No, the
snot.
nice thing is they work so collaboratively,
Yeah.
because they're also about bringing the body back to homeostasis, and they're really giving the body a nudge, but they don't have mineral salts and they don't have vitamins in them. So you still need the mineral salts, because that's so much about, what keeps our body functioning. Yeah, so they really do work very well together.
Yeah, absolutely. All right, so number 12 is silica, and this is a cell cleanser and a cell conditioner. So this one also works well with the hair, skin, and nails, and also works well with treating slow healing wounds. The thing to watch out for with silica is it expels foreign bodies from the body, which is great if you have a splinter and you want to get rid of it. However, if you have a pacemaker, it will also potentially could get rid of it. Okay, so you have to be very careful with any implants before taking silica in the long term. If you're taking a couple of doses, that's fine. It's not going to do any harm. But it is one of those that just be careful about who you're giving it to.
So boob jobs beware.
Yes, exactly.
What about fillings and things like that?
That's fine. As I say, it depends on what dosage you're taking and what it's going to do.
Tooth implants, it's not great.
Yeah.
Mm.
So if somebody came to me and they really needed silica, and like I had a lady came to see me yesterday, I can see she's got silica deficiency showing, but she's had both hips replaced. So I'm a bit worried about giving her the silica. So I will put a very small dosage in and watch it after, and hopefully after a month, the deficiency would have corrected itself. So what is quite a common sign that we see with the silica deficiency is ridges on your nails. And the ridges will go long ways with your nail. Okay, and that will be your silica deficiency. And it's a sign. It's saying so many people have it. So that's where I picked it up with her, that she has it. So then obviously as I question more, I can see that there is definitely a silica deficiency. But I just have to be very careful. And it wasn't the main reason why she came to see me. It was just my observation. So I can leave it out completely, or I can give her a small dose.
So with new nail growth, that will start to disappear.
Yeah. So if you go for a manicure, what do? They like buff it all down so there miraculously are no ridges anymore.
So the other thing you said, Cali Salt eliminates pus and waste products. Would that also push stuff out?
Yes.
So do you have to be careful of that one as well?
No.
Okay,
No.
in a different way.
It's this one, yeah. So what if, for example, with boils and abscesses and things like that, you would normally use a 12 and a 3 together, because those are the two that eliminate pus. Okay, but just be careful of 12 if there are other things going on.
Would that work for styes?
Yes, because you've got pus there that needs
Also
to.
Like a little boil, isn't it?
Yeah.
Or fever blisters.
Yep.
Oils work brilliantly for both of those too.
Yeah.
Tea tree
Yeah.
for both of them, and then lavender on guard.
Yeah. I mean, it's a lovely combination to use them together. Okay. So let's look then at, those are our 12 tissue salts. How to take them. So the first tissue salts are readily available in chemists, pharmacies, Dischem, whatever clicks. And I'm sure a lot of you would have seen them already in tablet form, little pink bottles, blue bottles, all kinds of different bottles. And for everyday use, that's great. Okay. I use the tissue salts in powder form. The only reason I do that is they are easier to dissolve in your mouth and therefore easier to absorb, and they're easier to mix together when you want to take a combination. So often if someone comes to see me, they might be deficient in 8 different mineral salts. Now, can you imagine trying to take tablets so those little mineral salt tablets, you normally have to take maybe 2 or 3 at a time. And you've got to do it 3 times a day. Now you've got 8 of those to do. You're going to spend your whole day taking tablets, letting it dissolve, take the next one, let it dissolve. So it does make it easier, especially when we're treating a more long-term condition or trying to get the body back into balance because it's been out of balance for a long time.
But also they're more pure, your powdered ones, because they don't have the fillers.
Yeah.
You don't have the thing that's holding it to make it a tablet.
Exactly.
Yeah. So I think that's important.
And
you're not going to get the same effect from a tissue salt powder as the tissue salt tablets.
Yeah.
And they all also are others. So they're like that Herbivore and what's it, Phytophos or whatever. Those, like I've got loads of those, but I know, and then I buy other ones from Wolida or other, and those are definitely better, far more effective. The other brands, the sort of mainstream ones weren't nearly as effective. And I think that's the difference also with the powdered ones.
And I know that, I mean, I haven't taken tissue salt tablets for a long time, but I know that once I ran out of something and we were on holiday, so I went into a pharmacy and bought some of the tablets. My goodness, did it take forever to dissolve in your mouth? Yeah, so it's just
even
crazy.
the Wolida ones that I took for COVID.
Yeah.
40 minutes to dissolve to.
And the powders, it's seconds. So if any of you have had the powders,
Lots of compliance from the kids. I mean, they just like,
Yeah.
they love it. It's the only supplement that they like that I've given them that they actually all like, and they'll like self-medicate.
yeah. So with the powders, the mineral is in a lactose base, but people then say, oh, but I'm lactose intolerant. It's not going through your digestive system, so it's not going to affect it. Okay, so those minerals are going straight into your mouth. So I've never had an issue with anyone who's lactose intolerant with taking the powders. And as I said, so whether it's a tablet or the powder format, you must make sure that it dissolves in your mouth. And your other option is to put it in water. So there's another mix that I have, which is called Revitalize. And that is really good if you're exercising. And what you do there is you do mix it in your water. So whilst you're exercising and you drink and you sipping your water, your mineral salts are in there already. And mineral salts, one of the pro golfers uses my Revitalize when he's playing. And he started off saying, no, but I need electrolytes. I've got to have my energy drinks and everything. Well, energy drinks are full of sugar and often full of caffeine as well. So if you're doing serious sport, probably not the greatest thing for you. And then in terms of electrolytes are minerals. Okay, so yeah, you need your electrolytes. Well, here we are, pure form. They're minerals. Okay, just another word for them.
It's like when you've had a stomach bug and you need to replenish yourself. A lot of those things have got loads of sugar in and they actually make your stomach worse and prolong it.
Yes,
exactly.
Yeah.
Absolutely.
So if you're using it for exercise, would you use it continuously to get back to that?
So you would use it whilst you're exercising, you would drink it.
Always? Ongoing?
Well, whilst you exercise. So if you exercise every day, you go to gym, for example, then you can take it. You should be drinking whilst you're gymming anyway, or whatever your exercise is. And that is just replenishing it straight away. Some people, let's say you go to, I don't know, something more sedate, Pilates, and you're not necessarily drinking all the way through because you're not sweating and getting rid of all of those things at the same rate as somebody who's cycling or whatever. You can just take some of the powder mix afterwards directly in your mouth.
But I mean, would you continue ongoing?
Yeah, because you're losing that whilst you're exercising, you're losing those
And
minerals.
especially when you see that so many of our athletes have actually really struggled in this COVID time because their bodies are inflamed or because they're not replenishing things. So we often don't realize how much we're losing when we exercise. So it's like cyclists and runners and people should be doing this instead of so they often are doing it. They think they're doing it, but they're using the goos or the energy drink sort of stuff, which is not. So yeah, this should just be part of the routine.
So you just continually, in other words, replace your electrolytes.
And it also the best thing you can do to your body is to tune into it and see what your body needs. So if your body is coping fine with whatever exercise it is that you're doing, maybe you need to replace it once a week, depending on what you're doing, which is fine. So just to listen to your body, hear what it needs, and to recognize when it's saying, like, okay, often with exercise, how are you going to know that you need magnesium? You're going to get a cramp. So you know you need magnesium. Magnesium is part of that mix. Okay, so in that mix is magnesium for the cramping and for the muscles to recover. There's iron in there to help with the oxygen getting around the body whilst you're exercising. There's number 9 in there to help with hydration, to make sure that your cells are absorbing the fluids whilst you're drinking. So it's that the combination is built up around what your body typically needs whilst it's exercising. But that's the thing with the premix, is that we're looking at the typical scenario as opposed to an individual case. Okay, so definitely if you can listen to your body, with my husband even playing golf, because he's still actually in a recuperation phase, he often he'll take his drinking mixture whilst he's playing, and then he'll get home and he'll say, I'm feeling absolutely exhausted, I need some direct powders, and then he'll just take teaspoon, go and lie down half an hour, take some more, and off he goes again. And he'll bounce back from, I just can't do anything, I just need to sleep for the rest of the day. Within half an hour, he'll be up and about again. So it really does help your body to recuperate after that expenditure of energy.
Thank you.
All right, dosages. So dosages for tablets are going to be different to dosages with powder. So let me see. Okay. So treating an acute condition is very different to treating a chronic condition. So a chronic condition, obviously, it's more you're looking for a long-term result, whereas an acute condition is I've got a headache now and I want it gone now. Okay. If you have a chronic condition, you can take a tablet every half hour. You can actually take it every 15 minutes even. Remember, you can never overdose, which is great. But I've had recently a friend came around, and we don't unfortunately have dogs anymore, but we were babysitting dogs. So my friend came around and she went, "Oh, dogs, I'm allergic to, I get hay fever from dogs." So I said, "Don't worry, the dogs are here. They're not going, I'm not going to push them out into the cold. They are with us. So take some hay fever mix." So the hay fever mix she took, 15 minutes later, took again, 15 minutes later, all symptoms gone. So it literally is 2 or 3 doses if you're taking it every 15 minutes.
Did she develop symptoms?
She had started to develop, she was like sniffing and sneezing and whatever as soon as she saw the dogs, which also might have been psychosomatic, who knows. But the point is that all those symptoms had gone within 2-3 doses. Yeah. So if you have an acute condition, just keep taking. You can't overdose. Just give it like 50, at least 15 minutes in between, just to let it get around your body and absorb, and then give it the next one. And often it's just a few doses and it's gone. Okay.
And is that like a quarter of a teaspoon, or I mean, you said 1 tablet, what would it be in pounds?
Yeah, a quarter of a teaspoon. Okay. And then obviously for children it's different, lower doses, and for babies it's lower doses again. Right. Okay, so the next topic was just about self-treatment versus going to a biochemic therapist. I would love it if everyone could treat themselves for acute conditions. Okay, so that is literally have in your medicine cupboard all the tissue salts. Those of you that are here, you've got a list of just a guideline of what you can use. I also have these little boxes here, which is a tissue salt first aid box, which is just the 1 to 12 in there, and that list that you've got. And there's also a list in here
that you've got. Sorry, for people online. I can get you a copy of it. I'll send you the list. I'll just have to see who was online.
Yeah.
Which is a summary.
Yeah. So this is the list for, I think this one's probably got a few more things on than yours. And in the box is also a list for common children's ailments and babies' ailments, so the colic and the croup and those things. So
you probably don't expire like other things do, or do they?
Theoretically they do, but it's got a very long expiry date. I think the tissue salts that I'm buying at the moment, I think expire in 2025. So they do have an expiry date.
Well, you have to for any stuff you have to put an expiry date on, but it's probably again similar to oils. As long as you're not putting your dirty spoon in and things.
Yes, exactly.
Which is a danger with our children. Scoop it out.
Poor little fingers.
Yeah, exactly.
But I mean, I think if you have bottles of tablets in your cupboard and they've been there for a few years, I'm sure they will still be usable. It's not that they're going to go off. Okay. Yeah, so then for your more chronic or complex ailments, that is when I would suggest going to a therapist. So what that would entail is I look at the first sign of mineral deficiencies show in your face. So before a session, I will always ask for photographs of your face so that I can stare at them before you arrive, because otherwise I'm going to be staring with your face and intimidating you whilst you're in your consultation. So I have a good look and zoom in and whatever before you arrive, and see what's showing on your face. Now, as your deficiency gets worse, so it goes into your body, and you start seeing others, you will start experiencing other symptoms. Which will show all over your body potentially, and then eventually get into your organs as well. So you may, just because you don't have deficiencies showing in your face does not mean that you don't have deficiencies, because maybe it's already gone beyond that and it's now sitting with other symptoms in your body. So a consultation is really about trying to understand what your current symptoms are, and whether that is, I have cracked heels, and I get headaches. So we'll work with that. But the more pieces of the puzzle that you can give me, the more I can get the picture of what's actually going on in your body. So, and often as I ask questions, and somebody will go, oh yeah, I forgot to tell you about that. Oh yeah, I forgot to tell you about that. So all these things come up because it might be something that you just learn to live with. And cracked heels is one that everyone gets cracked heels, is fine. Well, no, you don't have to have cracked heels. So we can correct it. So it's just trying to think about all of those things. So yeah, so I think you're just going to get, if you've got something bigger going on than your headache or your acute condition symptom that you're treating, I would definitely recommend going to a biochemic therapist that can help you get through that. And as I said earlier, my philosophy is you shouldn't have to be on tissue salts forever and ever. It should be, let's get your body back into balance, we reassess it, and it will take a few months. You're not going to get a quick result if you've had a long-term condition. Some people say that you have to take tissue salts to rectify your imbalance for as long as you've had the imbalance for. I don't necessarily believe that's true, because I think it can rectify itself quicker than that, especially if you've had something going on for years. Okay.
Are these specific ones that are like, for women that are aging, like your bone one? Are they something that you would take sort of more regularly, or once you brought it into balance, then it's sufficient?
Yeah, it would be something that I would monitor. So again, especially with the bone one, calcium deficiencies are quite easy to see in the face. So if you've got it back into balance now, we can see that the face is cleared. I would suggest, I would tell you what to look out for. As soon as you see that coming back again, you know what to do about it, or come back to me. So, but there are definitely some things that are going to take longer, and especially with the calciums, because they are so slow acting. So that is one that it might take a year before you get back into balance.
But the tissue salts for the calcium, it's a great question, because for osteoporosis, sometimes the supplements that we take and the medication that we take actually hardens the outside of the bones and can make them more brittle. So, I mean, as physios, we've seen a lot of women struggling with osteoporosis, and often the mainstream remedies we have are actually not great remedies. They can exactly, it's like putting a plaster cast around an area, and so it actually weakens inside. And and it's similar when women are pregnant and they're told to take more calcium. What it does is it drops calcium in the umbilical cord. So suddenly at 38 weeks, the gynae says your umbilical cord's calcifying and the baby's not getting enough nutrients. But it's because it's such a hard form of calcium, whereas the tissue salts calcium is so absorbable. So for things like osteoporosis, things like pregnancy and things, this is far more effective and far more. So just to say, while I'm busy speaking, I'll come into the screen here because I like to speak a lot. So like we're doing a wellness consult with Maryann, with each of us, with each of our children, just like we've got no specific issues. We're recovering from COVID, like Finn's lost a lot of teeth. I mean, they're all baby teeth, thank goodness. But you know, there's teeth stuff. Like everyone's got our little things. And so instead of waiting till someone's really sick or something big to come up, we're doing a wellness consult for each of us. And we've sent our pictures, and we're going to still have a consult. And then we'll have the tissue salts on hand for like more immediate stuff. But then everyone should have their little mixture that is appropriate for them at this time, and you know, going through different things. So I think it's the sort of thing that where we take proactive steps to support our health and to really, to empower ourselves so that we don't need to have the reactive stuff as much.
Yeah,
so
absolutely.
that's what I would encourage
Yeah.
for people to think.
Yeah, and it's about being well as opposed to getting ill and then trying to.
It's a preventative
Absolutely. Yeah.
approach.
And that's really was the purpose of a talk like this, is just to educate everyone to understand what's actually going on and what our bodies need. And if you have that kind of reference list, you can go to the pharmacy or wherever and get your tissue salts and have them on standby. So when you need them, it's easy to then start treating yourself with them. So it's something that I really recommend. Okay, questions from anyone?
I see there's some. Would you use number 7 for eczema skin issues?
Yes, definitely.
Okay. So 7 for eczema skin issues, and number 11 is called
Net Salt.
Net Self.
Different names, so I have to
And please write any other questions in the. It's actually Net Self, not Net Self, but any questions in the chat. And then if you'd like that handout sent to you, it's probably easier for me just to see who's here. Just write your name in the chat, and then I'll download that at the end and see who I can just WhatsApp it to.
Okay. On the handout as well, there are dosages, I think, on the top. Yeah, so just recommended dosages, but obviously if you're treating an acute thing, depending on how acute it is, you can just use your gut instinct on it as well. Remember, you can't overdose, but this is your guideline.
Okay. What would you use for like teenage bad skin? Would that be a 3, or would you mix with some?
So often pimples are at the acidic environment again. So I would look at, is it the acidity that's out, is the hormones that are out, it might be a combination. And then to clear the pus, then that's when you would go into your 3. So you want to, that's a symptom that's showing, but we want to get and treat the cause. So if you can get the body back into balance in terms of the acidity balance, then that should stop. Often with the teenagers, it's the greasy skin and they make it with it. That's all a sign of acidity, too much acidity in the body. And that acidity is often just because of hormones is one thing, and then what you're eating, the sugars.
How do you assess the hormone, for instance?
It's again, what are your symptoms, and then understanding what is controlling that. It's a bit of a very broad question that to be able to answer more specifically.
So someone had asked here, can we share contact details or website? So Maryann, I've just typed in Maryann details, and if you're on our Feminine Wisdom course, you would have got your period mix, and but I think your number's on that. And I think I even, did we put in cards? No, I can't remember. Anyway, but I have put here, it's Maryann Frank, for anyone.
I have got a website.
Oh, have you?
Recently.
Okay, so I'll put the website as well.
www.choiceshealing.co.za.
choiceshealing.co.za. And then, so that's just to ask where you are, Maryann, and do you do Zoom consultations?
Yes, so I'm based in Centurion, which some people think is very far out in the sticks. But with the biochemic therapy, I can do Zoom consults. And as I said, part of it is I've already diagnosed your photographs to see what's going on there. And then it's a matter of talking to you to find out what else is going on, what other symptoms are presenting in your body. And then we, of course, have to get the tissue salts for you. So if you just need one tissue salt, I would recommend that you go and just buy the tablets at a pharmacy. But if you need
good quality tablets.
But if you need a mix, or I mean, obviously I can sell the individual numbers as well. Then we just need to get that to you. I have clients around the country, so I just courier tissue salts out to them. So whether you are Joburg or Cape Town or wherever, we can courier.
And then you are practicing from Saxonwold once a week or once every second week or something.
From Zoe's house.
Yes, from Zoe's house in Saxonwold.
Yeah. So on demand, I'll come through there. So if I've got enough people from the local area that would like a consultation, then I'll just set it up for a day to come through and then see everyone in that one.
And then do you need to wait after eating, drinking when you take the tissue salts?
Good one. I forgot about that. Yes, so it's all just to do with absorption. So the recommendation is take tissue salts with a clean mouth. So if you are eating and then you put your tissue salts in and you carry on eating, you just not allowing maximum absorption. That's the only thing. And same with drinking. So if you are tissue salts and then drinking water or whatever, or whatever you want to drink, you're also just not allowing maximum absorption. So that's what it's about.
And the absorption is different.
Yes.
Because it would go through your digestive tract.
Yeah. So you want to try and keep it in your mouth until those powders have dissolved, then you know you're getting maximum absorption.
And then just to say, because so Maryann does sell these kits of the 12, but then she's also got these like bones and teeth. So I bought this one for our little boy, and just the cost of something like this, it's very reasonable as well compared to supplements. So this is kiddies, because most kids need it for bones and teeth.
There is a little, I've put together 4 kiddies ones. So there's one for tummies, one for coughs and colds, one for bones and teeth, and one for be calm. So just that one that calms them down a bit. So a bottle like that is a medium, is a small bottle is 85 Rand.
Yeah.
Okay.
So then
The individual numbers are slightly cheaper, but when they're combined, then it's 85 Rand. That's a small bottle. This size bottle is, sorry, I'm reading off my 1st of August price list because they're going up on the 1st of August. So let me just get to today's price list. So this size bottle would be 75 Rand. This one is 170 Rand. And then when I mix in a bigger bottle than this. It's about that big.
I've actually got it upstairs. I did we had a general maintenance one also when we had COVID.
Yes.
I got it from you.
Yes.
And it's a big one, and that was about
250.
Yeah. So so like there's hay fever, there's the period mix, the party mix, a whole lot of things. So specific, well, and general maintenance, and then a pack like this.
That pack, today's price is 400 Rand. And then there's a slightly bigger box as well. So that box has got the 12 salts in. The slightly bigger one has got the 12 salts, and then you can choose any combination of any 3 that you want from the mixes. Okay, so I mean, I've put 3 in there, but if you wanted to swap them out,
so that's got cold remedy, general maintenance, and hay fever. So
you can swap them out for any 3 that you want from the
bigger box there?
so maybe
one is 550.
So maybe for feminine wisdom, we can keep the July prices if we act fast. That's a gift.
Do you do the be calm in like that size?
Always make it especially for homeschooling.
No, exactly.
Is that for you?
Put in the water filter. Yeah.
For everybody.
I know. We also had a homeschooling emergency this morning, just before the bee talk, and Finn's like, can't find his Afrikaans book, and because he couldn't find it, he forgot to study all week. And oh my gosh, be calm. I'm like, put on oil, do your bunny breath, and just sit there. We'll speak to your teacher this afternoon. Yeah. So there's sinus mixer, all sorts of things. So, what is the cost of a consultation, Maryann?
Today's price
is
500 for
okay.
you.
Yeah.
Special for today, it's 500.
500.
But it is
Thank you.
going up on the
Before
1st of
4
August.
o'clock or so.
So 500, and then sorry, what did you say? It was 400 for the box without.
The small box of 12 is 400, and the bigger box is 515.
Okay, and I mean the thing is, like these are so in due course, like you really don't need to be using a lot of other supplements like the magnesium supplements, the calcium and magnesium. This is a far more accessible, easy version. All the family can use it. It's adults and children. You just have different, we all just take a teaspoon. So, and then we're definitely going to do the more specific ones for our family as well.
I'd like to do
Mm.
the more.
Yeah.
So Yeah, any questions in the room? Any questions online?
So would your magnesium mix or whatever produce the melatonin required to sleep?
It definitely helps with that, yeah. I would do a combination, okay, depending, again, what is the sleep issue? Is it falling asleep? Is it waking up during the night? So I need to understand exactly what's going on first. But that magnesium is all about relaxing. So it is going to relax you to help you fall
Would you
asleep.
take it in the morning, or would you take it more towards the evening? Evening.
Yeah.
So how minutely diluted are they? What potent, like, difficult because it's very different from homeopathy, isn't it? But
Yes.
like how
So
many times do they dilute?
it's D6 or D12, depending on which mineral it is. Does it make sense?
Yeah.
Okay.
How's it different to then homeopathic remedies? Do they work together?
Yeah. Also, homeopathy is, and correct me if I'm wrong, is like cures like, whereas here we're treating a symptom or a deficiency. So
Like giving the snake venom for a snake
Yeah.
bite would be the
Like a
premise of homeopathy.
yeah,
And then there's different strengths, like a D6 or 12 or 200 or.
yeah.
And a question here, Karika says, can the period mix be given to girls who have just recently started to menstruate? And I would think definitely so.
Absolutely.
Yeah.
Anyone and everyone.
And should be, you know, also, I think we have far too many, far too few iron supplementation and things, because it's, you know, it's not an easy thing to supplement with, but we should all be keeping up our iron and zinc. What is zinc? Is there zinc in tissue?
It is in the higher numbers.
Okay.
So
'Cause
not part of
this,
general dispensing.
but it's because obviously zinc is hugely on the radar at the moment. Yeah.
Absolutely. Yeah.
And the lack of this, you know, loss of smell seems to be very linked to
Yes.
lack of zinc.
Yes. Yeah. So again, with that loss of smell, it's looking at getting the cells to rejuvenate, especially the olfactory cells, balancing them with their fluid so that they can start functioning again, and also with the zinc will come into that as well. So it's really, when we look at a symptom, so the symptom is loss of smell, but let's go deeper into what's causing it, because then we can treat it appropriately. So, yeah, and zinc is definitely part of it.
Would zinc have been part of tissue salt's fork?
No, it's a separate tissue salt, but you can't buy it over the counter.
Okay, but when I took the tissue salt's fork, that did the trick. But I was taking zinc.
And for people that have had a virus and then a permanent loss of smell, my mother has that. Would you be able to rebalance it?
Yeah. So we need to regenerate those cells. So and that's the thing, is that it's the cells have actually been attacked and died off. So we want to regenerate them and make sure that they're functioning again. So we need to bring it back.
I know what I want to ask you. In terms of I believe it's a medication that gets rid of your sense of smell that they treat with. So could that work with regenerating the sense of smell while you're taking the treatment?
Well, if you're continuously taking the treatment, which you would be, it's going to keep damaging the cells. So yes, you can do this, but as soon as you rejuvenate them, they're going to get damaged again, potentially. So it's like I was saying earlier about the people on ARVs where their calcium is being depleted. Their calcium is always going to be depleted.
You always have to be repairing it.
Yeah.
And then I think we're going to sort of finish this online shortly, but just another question: is the list of mixes on the website of your mixes?
Yes, it is.
Okay, so that if people want to order the big box and then they can see what they want to add to that big box, can they do that by looking
Absolutely
on the website and then letting you know?
Absolutely, yeah.
Okay.
The prices are not on the website because I know that they're changing soon, so I don't want to complicate things. But you could always, if you any query with prices, my email address is on the website. You can just email me.
Okay, so Maryann's email address is on the website, because I've just put your cell phone number.
Okay.
Do you want to tell me your message?
It's Maryann at Choices Healing. Maryann.
Maryann at Choices Healing.
Yeah.
.co.za.
Yep.
And then someone says, I took the period mix last month and found my menstrual symptoms got worse and I stopped, but I feel like it should have probably taken the salts more. Is this common?
Yeah, absolutely.
Is it?
So remember that with the period mix, I think somebody did contact me from the group to say, should I be taking it every day? You don't need to take it every day. You take it when you're having your period. Or you can start the day before, because sometimes your symptoms are starting the day before. So if your symptoms are getting bad, take more tissue salts. Okay, because your body's telling you, I need more help, please.
All right.
So take more.
Okay.
Okay, so it's like that, what I was saying with when you're treating an acute condition. If you have a headache and you take one dose of a hot 8 and it doesn't help, take more.
Mm.
Still doesn't go, take more.
Mm.
Okay, your body's talking to you.
Very similar to the oil.
Mm.
Yeah.
Mm. Yeah, exactly. Don't have a tablespoon, just take that teaspoon
Yeah.
frequently.
That's what I wanted to say also about taking the powders is often with the powders, your sort of typical dosage will be maybe two teaspoons a day. But to stick a whole teaspoon of powder in your mouth can be a bit drying in your mouth. So my recommendation is rather take half a teaspoon at a time. You can take half a teaspoon, all at one time. You don't have to take one in the morning, one at tea time, one at lunchtime, but just to let it dissolve better first and not dry out your mouth so much. Okay. And again, with the 2 teaspoons a day, it's food. So if you want to take 2 in the morning, that's fine. If you want to take 1 in the morning, 1 in the evening, that's also fine. If you forget, it doesn't matter.
And let's say you're taking the period mix and the party mix.
Yeah.
If you if you have one, then can you take one sort of straight after, or will you space
space
a little bit?
Yeah, 10 to 15 minutes. Okay, depending on what you're taking though. And the party mix is a great one where example of the worse your hangover, the more you need to take.
And you take it before if you're going to. Okay.
Yes, if you know you're going out, take some before as well. So if I'm going out and I know that we're going to be drinking, I will take maybe 2 doses before I go out.
Okay.
And then another.
I'm just
dose
asking
when I
for a
get
friend.
back. Yeah.
Yeah.
Understand. Then you're joking. And then take another dose when you get home before you go to sleep, and then in the morning, depending on what the symptoms are.
Fantastic. Thank you.
Good.
So thank you so much, Maryann. I'm going to turn this off now. If there's any other comments, and then I'll download the video and send out the video and send you. Thanks for putting your names in here, so I can just see from the chat, and I'll send you the handout. But thank you for joining us from afar. You're welcome to unmute and say goodbye if you want to.
Thanks, everyone.
Thank you.
Pleasure.
Yeah, thank you.
Thank you.
That's my mum, who's always been a wonderful tissue salts advocate. So I said to her she'd love this.
Oh, good.
Yeah. Thanks, everyone.